Hi, I'm Dr. Andy Wright, and this is for Community Connects, and I'm going to be talking about vaping. I was supposed to give a talk, I think it was in the spring, and then we have the COVID-19 pandemic, and the title was Vaping, the Good, the Bad, and the Deadly. So we're going to go through this 15-minute talk, kind of keeping those topics in mind, maybe not necessarily in that order. All right, let's start with what is vaping. So it is a distinct way to deliver nicotine and flavors from smoking or from chewing tobacco, meaning it's a totally different inhalation method than smoking. So I'm just going to give you the basics here. Okay, you've got a battery, and sometimes that's rechargeable. And then you've got your reservoir, and that's where your vape juice is, your liquid. And so this can be disposable, this can be refillable. I'll just show you one of the other shapes as well. Then you've got what's called a heating element. And then this is delivered over the heating element where it's vaporized. And then it cools slightly, still a vapor. And then you've got, well, that's a frog, but you've got inhalation. All right? Now, so a cigarette, a regular cigarette has about 12 milligrams of nicotine. That range can be anywhere from 6 to 24 milligrams of nicotine per cigarette. The vape juice in 1 ml generally has anywhere, oh, it's fading, that's right, has generally 5 to 20 milligrams per milliliter, right? So you can take in a milliliter in a few minutes. And so you generally get that nicotine delivered a little quicker than you would with a cigarette unless you were smoking really, really fast. And so you get that high from the nicotine a bit quicker. Other reasons people prefer vaping to smoking is the smell. And then one of the other benefits, if you will, especially the folks who are younger than age for nicotine, is that because there's no smell, they can get away with it without someone else in their family detecting it, right? The other thing this allows for is addition of different flavors, and young people really like a variety of flavors and colors. We'll get into that in a little bit. And so it allows for more variety. It also allows for not just nicotine, right? So you can add THC. Conceivably, you could add almost anything. You could vape methamphetamines if someone was selling that, which would obviously be illegal. The vaping started in the US and Europe in 2006. It started in China in 2003. And it really started to take off in 2013. One of the reasons it started to take off was there was a lot of targeted marketing towards young people, especially by Juul, J-U-L, and they have like different colors, red, green Juul, it's black, it's kind of sleek with those different colors, different flavors. They actually settled some lawsuits, not of course admitting guilt, for their youth targeted marketing, and that is no longer allowed. In 2013 it really started to take off, and so usage started to go way up. And then in 2018, 2019 we had what the severe lung injuries called EVALI, e-cigarette and vaping associated lung injury, which then the usage has dropped just a tick for 2020. So that right now, if we look at 2019 to 2020, we think about 3% of adults are vaping on a regular basis, and of those, maybe 10% of those are also smoking and vaping at the same time. The highest group is 18 to 24-year-olds, and then in high schoolers, last year, 2019, almost a third said they had tried vaping in the last month on a survey. This year, it's 1 in 5, so that has dropped, and that's a good trend. Regular vapors in high school are about 1 to 2%, which from my perspective is 1 to 2% too high. All right, so that's kind of the background. Let's briefly go over the good, if you will, if we can call it good. which I think is debatable. So there are two camps within the smoking cessation treatment crowd. And one camp says, well, no, avoid vaping at all costs because you're just kind of stringing along your nicotine habit and you're not going to quit. There have been some small studies that say, well, there's this small group of people that they slowly decrease the concentration of nicotine. In other words, they're buying lower concentration nicotine juice, vaping juice, and eventually they'll quit. I can say in my practice, I've only seen that happen once or twice, meaning most people who do that just get to a lower nicotine dose and stay there. They don't actually quit. I think that's borne out in many of the studies, and so this is a very select group that may benefit. The other benefit, if you will, and remember we're saying benefit compared to smoking, we're not saying benefit compared to being healthy and breathing clean air, is that the amount and concentration of bad chemicals is lower, right? So there's carcinogens in cigarettes at a higher rate than there are in vape juice, but they're both there. Especially when you add flavors, you're dealing with the chemicals they need to make the flavors, just simple organic chemistry, benzyl aldehydes, and that is a known carcinogen, acetyl alcohols, and that can also be an irritant. There are fewer what we call free radical formations. There's no carbon monoxide, so that's exclusive to the smoking side of things. So we think, the theory is there's going to be less, say, damage to arteries for heart disease, maybe less damage for smoking, although we don't know that because this is so new, and remember, use didn't pick up till 2013, so we won't know that until 30 or 40 years from then. My hunch is we're going to see about the same rate of cancers, heart disease, strokes, maybe even the same rate of COPD related to smoking. I don't think we're going to see a huge benefit, if you will, between the two, but time will tell. That's it for benefits. There's really no other. Now we can talk about the harms a bit, right? So one of the biggest harms, and perhaps it's so obvious that we forget about it, is that it renormalizes the idea of smoking, meaning now someone's putting something in their mouth, just like candied cigarettes did. It kind of normalizes the idea of putting something in your mouth and getting a high from it. And so we know that smoking is associated with, not necessarily causes, but is associated with more use of marijuana, more use of hard drugs, not necessarily causative. So vaping, we would think, time is going to bear out that that's going to be the same for vaping. Also, you're inviting nicotine dependence. And if someone is dependent on nicotine, ultimately they're going to try to get it whatever way they can. Anyone who has tried to quit smoking, chewing, or vaping knows how strong of an addiction, or in this case not addiction, but dependence, nicotine is. A quick side note, dependence means your body's physically dependent and you're finding ways to get it. Addiction is when you're willing to compromise relationships or even the law to get a substance. That's addiction, or your job. So we're talking about more of dependence. And if we have kids who now can hide this very small device from their parents, it doesn't smell, you can do it in your bedroom, suddenly you are introducing more kids to nicotine dependence, which means more adults with nicotine dependence, which ultimately is going to mean more vaping, more smoking, more chewing, and more health problems. The cost of health care just associated with someone who smokes, if you take it on a population level, is in the billions, meaning if those people didn't smoke, the health care costs would be billions less, even hundreds of billions, some would say. The other harm, of course, was the high-profile lung injuries that occurred in 2018, 2019. Wisconsin had quite a few of these. In fact, some of it was locally manufactured. Fortunately, they did figure out ultimately what the cause was, and it's vitamin E acetate, and that was used as a condenser to make the liquid more stable. And often, or almost always, this would have been a THC kind of homebrew liquid that was made for it's called a mod, where you have a kind of a vaping device and then you put a tank in it. But not exclusively. Also, some of these rechargeables or disposables had that same vape juice. So while it's fortunate we discovered that was the cause of these severe lung injuries that are not unlike the severe COVID injuries, where the lungs are just cut up like Swiss cheese. There were cases where, just like in severe COVID-19 lung disease, you have the lungs popping spontaneously because they're so damaged. And we did have some deaths. In the series of 98 patients in Wisconsin, there were 2 people that died, several others with permanent lung damage. They can never, say, return to go running, and they will always have trouble even walking up a hill or stairs. So is it really worth it? I had personally one patient who suffered from this severe lung disease. Fortunately, she's made a fairly good recovery. So that's another damage. Of course, we talked about carcinogens, and then time will tell. We don't know what all these different organic chemistry molecules will be doing to our body. We know they're known carcinogens. There's something called nitrosamines. That's known carcinogen. Benzaldehydes, those are known carcinogens. And while they are at lower levels than, say, in a cigarette, formaldehyde, they're still in the vape juice. Probably another thing that we don't think about in terms of, I guess you could say, harm in terms of this, is you have concentrated packets of nicotine liquid, right? So as high as 20 milligrams per milliliter. The lethal dose for a toddler or a baby for nicotine is 10 milligrams. So if a child gets a hold of one of those pods and drinks it, they could die. Also intentional. There was a woman who committed suicide by taking, she just took 24 milligrams of nicotine straight, just drank it, and she died. Nicotine is a vasopressor, so it makes your arteries clamp down. It causes an increase in heart rate. It's a sympathomimetic, meaning increasing heart rate, increasing blood pressure, headaches, and she did have comorbid other health issues, but she basically killed herself using the concentrated vape juice. So then that leads me to the last part, the good, the bad, the ugly. We talked about the good, the bad, and the deadly. So what do we do to prevent this? How do we just like with smoking, just like with chewing tobacco, decrease usage, just like with alcohol? Well, you can think of this on a national, state and local, and then in your household or in the office level, right? So on a national level, we need to ban the advertising, which effectively it has been. As of September of this year, 2020, FDA is regulating the rechargeable and the disposable e-devices, and they can only flavor with either tobacco or menthol flavor. They're not allowed any other flavors. However, there's a loophole there in that these vape shops can still manufacture their own vape juice with any flavor they want. So the FDA has not been as strong as they could in regulating this, but it is a first step, right? So they all have to go through the FDA now. That also means we'll be tracking the harms more closely, but again, we won't know for a few decades. Cancers take decades to develop, so we won't have that answer. We also don't know how many more people will return to nicotine after seeing years of decreased smoking by making it basically socially uncomfortable and unpopular, and there's a danger there by making this more acceptable. On a state and local, and you can also tax, right? Just like you tax cigarettes, you want to tax the vaping about the same level. You don't want to push someone one way or the other, so you have to be very mindful in your taxing that it's the same level for the e-cigarettes as it is, or the e-pen as it is for smokeless and smoke tobacco. States can tax as well. We can send strong messages through our health departments. At home, you can provide an example. Don't smoke, don't vape. That is a huge way to provide an example to a young person when most people are introduced. The vast majority of people are introduced to nicotine in their teens. We have a few patients who come in. I started smoking in my 20s, 30s, 40s, but that's pretty rare. And so you want to talk about it. You want to send clear messaging. You want to talk about these lung injuries that occurred, and could they occur again? Of course they could. You get a new additive that causes a problem, it could easily happen again. We know about, with vaping, you get gunking and bronchospasm in the lungs. You can talk about that. In our office, we use a method called ask, advise, assess, assist, arrange. So we always ask somebody if they're using, we have to use a number of different words, right? Because it's a mod pod, an e-cigarette, a vaping pen, a vaping cigar. So you have to kind of make sure they understand what you're talking about. And then you ask if someone's interested in quitting. You advise on ways to quit, nicotine replacement, other medications to decrease the craving. counseling is a huge part of this as well. And then you're getting a quit buddy, someone to be accountable to, and you assess that readiness to quit, you assist them in quitting, and then you arrange for it, and then you always follow up. So I hope this helps you understand a little bit more about vaping, a little bit more about the problems with it, and ways to find a path to a healthier life. Thank you.